Thank you for joining me again. In our previous sessions, in a previous video, we worked on a hip, back and a core strengthening and a stabilization to get rid of all hip, back, sciatic, SIJ related problems. In today's session, we are going to work on a flexibility and I'm going to show you guys some stretch to help you to get rid of all these pains and aches. And so let's just start. First, we are going to, I will talk more later. So I want you to, we need a wall for the first stretch, doubling up the mat, or you can have a cushion, some cushion if you have a sensitive knee. So first of all, we're going to do a quad stretch. So the first this is a cause, most of the cause, because quads and hip flexors are very tight. Okay, so get a wall. Now if you don't have a wall close to you where you're doing it, you can use a chair, you can use some step. Okay, so foot staying on a wall, and I'll explain a little bit more. Other leg staying forward like this. Okay, so making sure both hips are staying aligned, and I sort of bring the left hip forward. Watch again. So place your hands onto the hip here, and I slowly, slightly tuck your tailbone in. Good. You will instantly feel that stretch there, and that's what we're working on. So the more you're trying to tuck in is the better, and try to squeeze your left glute, your left buttock. Keep tucking in, keep drawing in, and keep pushing that foot against the wall so that you feel that stretch there. Okay, you can use the wall to do this stretch, or you can also have a chair. Okay, so if you don't have a wall, all right, so now what we're doing is we're bringing your hands behind like this, not letting back hyperextend, and we're trying to do this stretch. Okay, so why I was saying why I started with this muscle, you know, this is the most common problem. We are sitting a lot these days, and our hip flexors and the quads get very tight, and that's why we have a pain. That's why our hips and our back is constantly working. We're not aligned. So doing this stretch, we are aligning our back. Okay, pull the tummy and push, and we'll just hold there for another 10 seconds. Good. I can tell you, you see, look, I know this is really, really bad when someone have a back or any pain. Okay, let's just rest. Switching a leg. Become very negative is you can't tell anyone about your pain. Okay, now see that knee and hip staying aligned. What I want to do is just gently tuck your tail. So you're sort of pushing your tailbone forward, pulling the tummy. Good. Both hips are staying aligned. Bring your hands onto the wall and push your hip away from the wall. Okay, so not staying down like this, but trying to tuck in. Keep your torso slightly forward, but push with your foot and stretch your quad. So you can tell about your pain, but no one else except you can feel that pain. So no one else can relate to that pain. It's become very frustrating, and you're very edgy, very moody inside. So what I'm trying to say is, like, be positive. We talked about drinking lots of water, eating healthy food, reading some good books, changing your mind from the pain and thinking something and doing something good. Okay, thinking positive and doing something good and positive, being happy and positive and in the present moment. Okay, keep tucking in, hold here. I'm talking to keep you entertained, so you stay with me and you look after If you started this video, please follow through these exercises, and I promise you're going to feel really good after these exercises. Keep pushing that hip away from you. We're going to hold this stretch for a little bit, and that's why I want you to stay with me. Good. So we're going to stay here for another 10 seconds. Push that tailbone forward and feel that nice good stretch on your quad there. Good. Okay, let's do once again. So you place your foot up onto the wall like this, and I'll turn around and show you without using the wall. If you're finding your quads are very tight, so you don't have to use the wall. So just place the foot here. Watch me here. Now, if your foot on a wall, you're still doing the watching. Now, think about lifting your ASIS up towards your lower ribs. So like sort of crunching. You got it? Good. And try to tuck in and squeeze that lower buttock. Good. So holding here. Now, if your foot is on the floor, push that foot down towards the floor. Tuck that towel in and let that quad have a very good, nice, good stretch, lengthening. Good. So we're going to hold it here. Now, if you get used to with this stretch, you're not finding any stretch, you can flex and you can add that stretch a bit more and draw that tailbone in. Okay. Rest is very important. Sometimes all you need a good rest. So once you've done these exercises, you've done your stretches, it's always good to have a little rest. If you don't have any pain, go for a light walk, small walks, not too much. Sit in the fresh air, breathe deep, and try to be positive and happy. Good. Okay, so hold it another 10 seconds. We're holding this stretch at least 2.5 to 3 minutes. That's why I'm taking along. But rest of the stretch we will do a bit fast. Good. So what we did the quad stretch. Okay. The next stretch we're going to do a hip flexor. We need to do the right leg again. Okay, let's try again. Good. Also find which sides are tighter. Okay. So sometimes your right legs are dominant. Okay. So if you find this is a tight, this is not as much. Okay. So try to spend a little more time on the tight leg, and as after a little while it started getting better, then you can just spend that even time on both. Okay, keep pushing tailbone, keep feeling that nice good stretch. Good. We're holding. Breathe in, breathe out. Keep the tummy in, hands are staying behind, or you can simply place your hands here and breathe in consciously through your nose and breathe out. And getting rid of all the tension, all the fear, all the pain. You're feeling good, feeling calm, feeling comfortable. Doing the stretch, you try to breathe in and out deep. So you're getting rid of all those toxins, all the bad, all the lactic acid, all the bad from your system. Good. Push all the pain away. If you feel joints are becoming relaxed, you're becoming calm. Good. So another 10 seconds. Keep the tummy in. Good. Just stay there and let's rest. Good. Okay. So let's just stay with me. You facing me. I'm going to turn to show you doing how to do the hip flexor. Good. We worked on a quad only yet. Good. So this time foot staying down here, knee and hip aligned. Good. Alright, so the right leg outside, I want you to just go slowly forward, keeping your tummy in. So feel your tummy staying in, not pushing out. You can keep your hands here to feel it. And just come forward as far as you can. You're feeling nice good stretch here. We're staying there We're not forcing, not pulsing. I'm just going to hold here for a little while. Good. Try to keep your chest up. And place your both hands here. And breathe in, breathe out deep. Feeling positive? You're feeling good. Inhale, exhale. As I said, like, you see like lots of people, they sit in front of computer, like kids doing the studies, their assignment, driving the cars from one place to another place, just sitting on a couch, watching TV. Okay, let's rest. Good. Okay, switch. I also think, okay, so slightly tuck first, turn the left knee out, and just come forward. I also think the couch, or so-called nice sofas, they're not really human friendly. They are good for dogs and cats because they can sit comfortably there, but the humans have to always slouch. They have to like curl like this, and they're very soft, so your sit bone, it doesn't give the signal back to your brain, tells you you need to be upright, you need to be straight. Also sort of crunching, we don't breathe properly, but anyhow, we're talking about the hips and the back. So these muscles get weaker day by day, and that's why we have pains and aches in our back and hips, okay? So if you want to get rid of the back pain, get rid of all those couch and cushiony chairs and sofas, good, and back. Learn to sit on the floor, on a cross leg, sitting on this position, sitting on butterfly position, okay? So these positions are really good. Okay, let's change now. So bring the right elbow onto your right knee. Come forward. So this time we're going to do both stretch together. Hip flexor and a quad. Bend the leg and then grab your foot. Hold it there. Keep the tummy in. Keep breathing deep. And if you want to sit, you have to do these stretch often. Okay, so you have to do these stretch. So your body stays aligned. You stay in a center of gravity. Your body is not misaligned. Always remember, when you're standing evenly on both feet. People use one side of the hip, one side of the leg. They stand for a long time. So we're holding this stretch for a little bit. You can use your both hands to hold the stretch. Good. Okay, let's rest. Switch now. Girls use women use the high heels. I'll strongly recommend get some flat shoes. It's important. High heels are really bad because that keeps your body. You're always in a constant battle to keep your body in balance. Okay, so you need to be straight. Learn to walk bare feet on the grass if you have some nice good park around you. It is really, really good. Your body, your brain works with all the other body parts and then find its alignment. The body is very intelligent, but giving all these fancy good chairs are ruining, corrupting our intelligence. Okay, hold that stretch, keep breathing. I'm not saying you're doing it wrong, but mostly all of the humans are doing it wrong. Good. Okay, so I think we're done enough with this one. Let's rest. Good. So I'm just going to keep the mat as it is, but I'm just pushing away so that I can see you now. We're going to sit down now. Good. So we've done these stretch. They're very important. Make sure you do these stretch. It's really, really helpful. Okay, so let's just bend the left leg and place your left ankle up onto your right knee. Bring your arms behind. Good. Okay, so slowly lower your left knee down and bend the right leg. Not too much, but just as much as you can. Good. Chest up. Pull the shoulders. Keep breathing. Not forcing a stretch. Just feel positive, think positive doing these stretch. Very calm and relaxed. Lengthening those muscles. Feeling good. You can do strengthening exercises one day and stretch exercise one day if you have any back or hip pain. You can do strengthening 2 days and the stretching one day. But I want you to do at least strengthening exercise for a week, at least regular, to strengthen, and then do stretch. Lots of people just only think about stretching. The stretching helps to realign, but doesn't help to re-strengthen and stabilize the muscles. Okay, so you always have to strengthen the muscles. Good. Okay, let's just rest. Change. Good. If you have a back pain, if you just sort of come to these exercise, back, hip pain, there are some other Pilates videos I made earlier. Good. And you can also follow those ones as well. But it's better to getting a little bit of advice. You can always send me a message and I can talk, or you can talk to a physio or talk to your trainer, and you can follow those programs. Okay, so just really, really good videos to follow. Just stretching hip. Breathe deep. Inhale, exhale. Inhale, exhale deep. Keep your chest up. Keep your tummy in. Very gentle stretch. Anyone can do these stretch. Okay, so let's just rest now. Perfect. Nice work. Okay, so I want you to keep your both legs straight, and I want you to separate your feet slightly so your feet coming hip width apart, hands are behind. Good. We are going to do a neural flossing, neural stretch, but we're going to do it in a 2 or 3 goes. We're not forcing too much. Okay, so spread all your toes. Make your legs straight and aligned. Good. And just flex your feet. So you will feel stretch behind your calf. Good. And point. Good. Right now, breathe out, you flex, and breathe and you point your feet. Good. Okay. Breathe out as you flex, you look up, and as you point, you look down. Flex, and you look up, and point, you look down. We'll do 3 more. So breathe out, you flex, and look up. Last one. That's beautiful. Good. Okay. So now spread your toes again. Nice. Okay. So this time, point first, inhale. And as you exhale, you flex and you look down slowly. Point. Do it slowly. Keep your back upright. Flex the feet and just lower your head down slowly. Inhale. We'll do 3 more, not forcing too much. If you're finding any pain, just modify, don't overdo this stretch. Good. Last 2. Exhale. Neural flossing. Last one. Perfect. Good. We'll come back onto a bit more stretch there. So legs are together. And I want you to bend your left leg. So the left heel close to our right knee there. And we're sitting tall. And the right hand onto our left leg. Good. Left arm back. We're pulling the tummy. Engaging the core. And slowly pulling this leg towards our shoulder. And rotating our spine. Pulling the tummy. Good. Not forcing, but think we're stretching that outside of a hip. So stretching the hip and then stretching our eye to the, but very gently, not forcing this stretch. Keep the tummy in. And don't force your spine to turn too much, just slightly. You're doing really good. So stay with me for another 5. Deep breath there. 4 more. 3. 2 more. Last one. Okay, come back now. And let's just change. So, right heel here, sitting tall. Good. Chest up. Pull the tummy. Good. Alright, so left hand here, right hand here. Let's sit tall first, chest up. Keep the tummy in. And gently pull your leg. But before you're pulling leg, think again, focus your adductors, your internal hip rotators are working to bring the knee. Keep the tummy and chest up and stretch your hip from outside. Turn the head. Hold it there. It's a really good stretch. Just really good stretch to get rid of all the hip pain and back pain. Five more deep breath. So just we have to hold these. We have to hold these muscles. So we have to hold this stretch to lengthen. Okay, so we're slowly increasing the time. If you're doing on your own, try to increase the time, but just do with me if you want to. Good. Just 2 more breaths there. Okay, come back now. Perfect. Okay, so now we're coming on to another neural stretch. Okay, so feet are slightly apart again. Good. Legs are straight. And lift both arms up. It's a really good stretch. Lift both arms up. And then bend your right arm and your left arm. So see, my necks are free, but I'm bringing both hands really further back and lifting my elbows up towards the ceiling. Good. Okay, so pointing the feet and breathe out. We're slowly coming down, not too much, but just slightly. Good. Inhale up. Okay, so we'll do 4 more. Slowly exhale, coming forward. Inhale back. Think your back is against the wall, so sitting up tall, chest up. And as you're breathing out, you're slowly curling, just curling 1 vertebrae at a time. Inhale back, not forcing. 2 more. Last one. Exhale, curl. Okay, so stay there this time, keep the tummy in. And now you flex your feet. Exhale. Point your feet. Exhale. You might find tightness behind your calf, behind your knee, or maybe pain in your hip, or on your back, behind your neck. Don't force too much, just do it slowly. Last one there now. Point your feet and sit tall, chest up, arms up and down. We almost done our stretching exercise. Doing really well, so just lifting both arms up. Yeah, okay, so this time bend the left, bend the right. Good, just the same stretch again, but this time you flex your feet first. Good, legs are staying aligned. And breathe out going forward. Not forcing too much. Inhale, sit tall. 4 more. Three to go. Last 2. Feel strong. Hold the tummy as you're coming forward and exhale. Don't hold your breath. Last one. Okay, so hold here, keep the tummy in. And now doing a slight little pulse for 5. Breathe out, coming down. 3, 2, and 1, and back. Now, if you have a back pain, if your back or hips are hurting, I'll avoid doing a pulse. Or if you want to do a pulse, do it very slowly, not too much. All right. Now, I'm going to do a stretch. Obturator internus. So I'll show you again. Bend the right leg like this and left leg back. Now with the left ankle and knee, we need a straight line there. Okay, so arms are back and just slowly coming back. We're going to feel that stretch inside there, and also there's a slight stretch on the back of an internal obturator internus. Hold it there. Keep breathing. Keep your chest up. Keep the weight back onto your hands, not overdoing this stretch. We are going to hold this stretch, so you are stuck with me for a little while. But just keep enjoying, just keep breathing in and out. Good. Don't think I'm here, it's just your own mind guiding you for a good life, for a good healthy life, good happy life. And you see, exercise is a very important part. I was sitting once in a park meditating, and these birds, I just sort of suddenly opened my eyes and seeing these birds are running in the grass, and they're not eating anything, they're not trying to get any insect or anything, but they're moving, looking in the grass, and they're just putting their beak in, out and running here. And I realized they're doing exercise. So just doing exercise so that they can get their meal. And they were not hungry, they were just running and chirping, happy. It felt so good, seeing, like, you know, see the cats and dogs always doing some kind of stretch. All the animals, only us human, we just sort of lost this sense of, okay, good. We have to go to experts to do exercise. Let's other side now. Now you remember this staying aligned. Good. And I bring that arm behind and just go back. But seeing those birds and animals doing exercise just felt like, you know, yes, we have to, our body uh, is our priority, our body is our responsibility as an intelligent, no one's else, so we have to look after. Just think you are looking after, you are listening to your body, not overdoing it. Good. We get very sad, we get very sorry, we feel very sorry for things happen, we worry about work, we worry or insecurities, think about relationships. You see, I never see any animal doing these things, worrying about money, worrying about food, or worry about, it's a provided, it's given. But we as a human, we have so much, but we still worry. So there's no end of worry. I just keep stretching, keep breathing in and out deep. So let go all the worries, all the insecurities. Let go all the tensions. Let not drain or waste any of your energy or thinking anything is not in your hand, okay? So not to worry about anything, just enjoy your life, the precious life, human life, a gifted life. Just a little more. Good, and back. Perfect. Alright, so we're now going to do a butterfly stretch. I'm avoiding lots of forward bending stretch. We did a stretch doing the neural stretch, but that's it. Okay, so grab the ankles and bring your ankles towards you now. Chest up. Good. Pull the tummy and grab the ankles. Lean just slightly forward and push the knees down. Breathe. Holding a stretch. So I'm not pushing with my elbows now. All I'm doing is I'm squeezing my buttocks and I'm trying to lower my knees down further. So I'm stretching more of my groin, stretching my inner thighs. Good. Keep lowering the knees, keep squeezing the buttocks. Stay there, keep breathing. Sit tall. Just 10 more seconds. Okay, let's rest. Beautiful. Good. Okay, so the last 3 stretch. Legs are wide. Good. Not too much. Just legs are wide here. And bring it back if you're finding it's too hard there. Hands are here. Pull the shoulder. Good. Now feet are not falling outward. Try to control and pull the legs in. Hands are here. Pull the shoulder. And pull the tummy and slide your hand slowly forward. If there's too much pain, don't go too far forward. Good. And I'm just going to hold on to the stretch here. Beautiful. Not going too far forward. Just stretching. Like if I can go all the way, I'm just staying halfway here. So think about just doing a half stretch. Not going too far forward. Just 30 seconds. Keep flexing your feet. and slightly internally rotate your thighs. Okay, let's rest. Good, legs are coming back together. Now if you're doing these stretch every day, if you're joining, if you like my session, if you're enjoying these stretch, you can increase a little time, because you can even write these stretch, and you can do every day and increase the time. Good, so legs together, sitting up tall, and just place your left hand up onto the right leg, right hand back, sitting tall. If you can't sit tall, if your hamstrings are tight, you can bend the knees slightly, or you can use some cushion or a stool to sit on, or block to sit on. Pull the tummy and turn, looking back. Making sure, so have a look on my feet. My feet and knees are not changing, so they're perfectly aligned. Feet are flexed, legs are straight. We're keeping the tummy and rotating the spine. Holding the stretch. Okay, let's change now, turning the other side. So right hand inside or outside of the left leg. Good. And left hand back, sit tall, pull the tummy and rotate. Feet and hips are staying stable. You're rotating with your spine. So making our spine flexible and supple and stretching all the tight muscles. And I just come back now. Very good. Okay, so both arms on a side. Separate your feet slightly, not too much, just the shoulder width apart. Hands are here. Good. So lift the left arm up and breathe out, stretch to the sides, lateral stretch. Inhale back. Exhale. Breathe in and breathe out. Breathe in and breathe out. So 4 more. Exhale. 3. So get rid of all the tightness, all the fear, all the tension, feeling free, feeling comfortable, feeling happy, feeling good. And let just rest. Good. Sitting cross-legged. Almost there. Good. Hands up here. Good. And just let go all the tightness from your shoulders, from your neck, from your back. Good. Slowly rolling up and back. Good job. Up and back. Good. Let's do back to front. Inhale. Exhale. Inhale. Exhale. Just 2 more there. Exhale. Last one. That's perfect. So hands are staying onto the knees. Let's sit up tall. Chest up. Lengthen the spine. Lift the spine. Lengthen the crown of your head, just really reaching, and turn your head side to side. So thinking about the whole spine, looking after the whole spine. Good. And releasing that excess tension. We hold the tension in the body very tight. Good. And back. So just pull the head back now. Just drop your head down to the right shoulder and back. Drop your head down to the left shoulder and back. Just a few more. And back. Last one. And back. Good. Okay. So look down and up. Perfect. Look down and back up 2 more. You're doing really good, just feeling free, feeling comfortable. Last one. Good. Okay, so inhale, open your arms. Exhale, curl your back slowly. We'll do 4 more. And curl. Relax your back now. Exhale and curl, feeling good, feeling free. 2 more. Last one. And curl. Sit tall now. Okay, so shake your arms, shake your hands. Just feel letting go all the nervous tension from your body. And what you do is, as you open your arms, hands, you breathe out. Let go all the fear, all the tightness, all the anger, all the tension for next 5 times. Go. Good. Hands in front of your chest. Thank you very much. Good. Shake it. Thank you. I'll see you next time and let me know how you go. Think positive always and do some exercise and stay well. Thank you. Namaste.